Hello, friend. Welcome to episode 12. I am happy to have you here. I have something for you today that I'm really excited about. So, the skin is the largest organ in our body, and it's a strong indicator of our hormone health. Thyroid problems, in particular, can trigger changes in the skin, nails, and hair that are frequently the first signs of hypothyroidism. And part of feeling better is feeling good about your skin. So today I will be sharing with you a wonderful conversation I had about hormones and skin health and thyroid with a special guest, Dr. Mary Alice Mina. Dr. Mina is a Harvard-trained, double board-certified dermatologist, dermatologic surgeon, and a leading expert on skin health and skincare. She is the host of the podcast, The Skin Real, for people looking for real skincare guidance by true skin experts, where she emphasizes the holistic and preventative approaches to skin health and aesthetics. So with over 15 years of clinical experience, she is an invited speaker on many podcasts and at national meetings. She's recognized for her artistic eye and surgical skills while helping people feel good in their skin. She's the co-owner of Baucom and Mina Derm Surgery in Atlanta, Georgia, where she treats patients with advanced surgical and cosmetic procedures to restore and maintain their healthy skin. So just a few of the topics we covered in our conversation include the skin effects of hypothyroidism and other things that you can do if you have urticaria or hives or chronic itching, as well as what's involved in a full urticaria workup. We also talked about acne and polycystic ovary syndrome and perimenopausal hormone fluctuations and how that affects the skin, collagen loss in menopause, hair loss supplements, the importance of vitamin D3, and my favorite part, a great minimalist skincare routine that uses affordable products that you can find in the drugstore. And I was very happy to see that my own minimalist skincare routine fits right in with what she has to say. We also talked about some other hypothyroidism skin problems and what can be done about them. So this was really a fun conversation. So I really hope you enjoy my conversation with Mary Alice Mina, theskinreal.com. Let's go. You're listening to the Beyond the Thyroid podcast. I'm your host, Dr. Dana Gibbs. I'm an ENT surgeon and hormone specialist. For years, I struggled with my own unrecognized thyroid problems before and even after I was regularly performing thyroid surgeries. Then, one day, I learned something that turned my health around and opened my eyes to the limits of mainstream medicine in treating more subtle thyroid abnormalities. I spent the next 20 years fine-tuning my hormone expertise in disorders like Hashimoto's disease, perimenopause, and stress-related illness. Come join me as I share this new approach to hormones that empowers you to take control of your own thyroid and hormone imbalances. Let's dive in. All right, everybody. Hi there. Welcome to the episode. So today I have a special guest. I'm excited to welcome Dr. Mary Alice Mina to the show. And hi, how are you? It's nice to see you.
Hey, yes, it's great to be on your podcast. I'm so excited that you've started this podcast because we need that. And yeah, I've been thinking about you a lot because your episode just aired on my podcast back in the summer. So it's fun to now return the favor.
Yeah, no, this is great. So why don't you introduce yourself? I mean, I already kind of introduced you, but why don't you introduce yourself and tell people how you got into podcasting and getting a social media presence going?
Well, yeah, so I'm a double board certified dermatologist. I practice in Atlanta, Georgia, and my practice tends to focus more on procedural dermatology. So I see, unfortunately, a ton of skin cancer surgery, but I also joke I'm like Dr. Pimple Popper ATL. I do a lot of cyst and lipomas, and then I also do a lot of procedures just to help people restore their skin complexion and help them feel better in the skin they're in. But what I realized back a couple of years ago is that it's really hard to see all the patients. I want to get the message out about skin health. And it's also hard to really delve into prevention in these very short insurance-based visits that we have and lots to cover. And so I felt like I can reach a wider audience through podcasting. So that's when I started the podcast, The Skin Reel, because I just felt like there was a need for good, scientific, expert-backed skin information out there. And so I've been doing that now for about 2 years, and it's been a lot of fun. Get to have a lot of interesting people on and smart people like you, Dr. Gibbs. And it's also been a great way to share my message on other people's podcasts.
Super. So what I really am curious about today is, well, okay, you know that the majority of the folks that I see are having hormone-related imbalances issues. So they come in with a lot of different dermatologic skin and hair and hives and itchiness and maybe even itchy ears that they want to take care of. And it really can put a lot of strain on your skin. And so I want to know what you tend to recommend for people who are not happy with the quality of their skin, if it's dry, if it's itchy, if it's pale, if they just don't like the texture of their skin. What do you recommend for folks to do when they've got those kind of issues?
Yeah, absolutely. Super common problem. We see this really at all ages, but I'll tell you, as someone in her mid 40s, and I see my friends coming to me and family members, I have these concerns, right? All of a sudden you feel like in midlife, wait a minute, this isn't my skin. Or you look in the mirror and you're like, who is this person looking back at me? That, I find that this is sort of a pivotal moment, and we start to see changes with aging, whether you have hormonal stuff going on top of it or not, right? Just midlife is, you do as a woman have hormonal changes and fluctuations. Mm-hmm. And so I find that this is the time period where people who maybe had been not really worried about their skin, didn't really have to think about it, all of a sudden they're like, wait a minute, things are changing, things are different. They're not happy, they're discouraged. And then to top it off, we are just being bombarded with information and misinformation on how to take care of our skin. And so we start buying everything that we see. And this beautiful celebrity recommends this. And this really, popular influencer recommends this. And so now you're buying all this stuff, you're trying all this, wasting a lot of time, wasting a lot of money, and nothing is working. So I totally can relate to that. And I see it a lot in my friends, my family, and myself as well, and my patients, right? So I would say first and foremost, take a deep breath. You are not alone. What you are experiencing, I would say most women are as well. At some point, it's going to catch up with us, right? Like no one is immune to this. This midlife, it's going to happen to all of us, these hormone fluctuations. So take a deep breath. And I would say if you can, see a dermatologist, right? Like we are trained to take care of the skin. And so if you can, I know it's hard to get in, but if you don't have a dermatologist, now is a great time to establish that relationship, because when you get that rash or that urgent thing, it's always good to have your dermatologist, like to be an established patient. So I would say go in and see a dermatologist, and they can help address these skin specific needs that you have. And everyone's needs are different, right? And everyone's skin care goals are different, right? And so that's how I tell people you have to create what habits. They'll say, well, what do I really need to do? I say, well, sure, that's going to vary, right? Because your skin needs, like maybe you're struggling with acne, maybe you've got rosacea, maybe dry skin or sensitive skin is your issue. That's going to be different from someone who has really oily skin and is getting a lot of breakouts. So we're going to manage those differently. And then you also have to think about, what are your goals? Are you someone who is aesthetically focused, someone who really wants to do cosmetic procedures, wants to try to maintain their youthful appearance? Or are you someone who's like, less is more, I want to age naturally, I don't care about any of that, right? So that's also going to play in. And so you have to pair those two together, and then you get your skincare habits that you need.
Sure. Sounds great. Are there anything that's just really, really basic that you're like, okay, everybody who's over
Yeah.
40 ought to be doing XYZ.
Yeah, well, so I'd say their skincare can be really simple, and my skincare is incredibly simple. It doesn't have to be expensive, it doesn't have to be time consuming. People don't believe it, but I get most of my products from the drugstore, not because I'm cheap, but because they work. These are huge companies that I'm unsponsored or what, but Neutrogena, CeraVe, Vana Cream, La Roche-Posay, these are not like little rinky-dink companies. These are massive skincare companies that have dermatologists as consultants and helping them develop their products. Lots of R&D for research and clinical trials and stuff like that. So
Mm-hmm.
don't feel like you can only buy expensive products to get beautiful skin. That's not true. But the basics that pretty much everyone needs, really regardless of age, is a gentle cleanser, a moisturizer, and a sunscreen. And so that is for my true minimalist. That's really all you need. And again, it doesn't have to be expensive or fancy. Now, if you're someone like me who is like, well, that's fine, but I still want to look good. I still want my skin to glow and look beautiful. Then I would also recommend for people 40 up to incorporate a vitamin C serum in the morning. So you'll wash your face, splash with water, and then use your vitamin C serum and then sunscreen, because gets people confused. And then in the evening, I'm a big fan. I love a vitamin A cream, which people probably recognize as a retinol or a retinoid. The retinoid is going to be your stronger prescription strength. And I absolutely love that. I mean, really, if you can start on that before your midlife, that's even better.
Yeah.
But that is really going to be a powerful collagen boosting product. It's going to help with cell turnover, which slows down as we age. It's going to even out your complexion. But again, I think people quit on retinoids and retinols too soon because they can be irritating. And it does take a while to see the results. It's like working out, right? You don't work out for a week, a month even, and expect to see these like dramatic results. You have to kind of stick with it. But really in the long run, I think it's the best and the most effective money saving product other than sunscreen you can have. So that's my skincare routine, and it can be that simple. Now, some of your listeners may struggle with acne, which is really common as we're noticing these hormone fluctuations in midlife.
Yeah, I have a lot of PCOS patients that I see, and we work really, really hard to try to get their diet under control, get their insulin levels down so that their diet is under control. But yeah, if you've gotten anything for those folks, that would be phenomenal. That would be really good.
Yeah, absolutely. So this is where, right, like someone with PCOS, they're going to have a different skincare need than me. And so what would I recommend for someone like that, where they have increased androgens that are really hyperactive, causing increased sebum production and acne? And so for them, I love a prescription called spironolactone. I don't know if you use that or are familiar with it, but it's a great way to target that hormone. Well, we say hormonal, right? But they're really all hormonal, but to target that acne that's very androgen driven. And the other great thing is people with PCOS a lot of times have hirsutism, where they get those dark chin hairs, those dark hairs along the lower face, which no woman wants. And it can help with that. So I really like it for PCOS patients as well. Tretinoin, the Retin-A or the retinol product I was talking about in the evening, that's going to be a great one to be on if you have PCOS and are struggling with acne. And then there also is a newer clascoterone, which is a topical anti-androgen, and that can be applied twice a day. The great news is there's, I guess if you have PCOS, you might want some systemic absorption, but there is no systemic absorption of it. And it's tolerated really well. So if you can't handle a retinoid, your skin is just really raw and irritated, this is a good option for someone who is struggling with acne. So, and then of course, simple things like benzoyl peroxide wash. I mean, this is like such a staple in my house and was when I had acne. I mean, as simple as benzoyl peroxide. I like the wash because it will bleach your clothes. Anyone who's used it.
Oh, dear.
You get those marks on your towel. You think you washed your hands. So I prefer it in the wash formulation. About 4 to 5% is ideal. Higher than that, you tend to get irritation and no improved benefit. But that's a great, if you're struggling with those red, tender, painful, more nodulocystic acne, or the red inflamed acne, it's a great
Yeah.
option to use when you wash your face or in the shower. And you can use it on your back, your chest, really anywhere you're getting acne.
Okay, so in the shower and use it as a wash. That's cool. Yeah, I've been recommending
Yeah,
something called saw palmetto, which is an herbal supplement that seems to help some people. But yeah, I like
as
your
a
method.
pill.
It sounds it's a capsule. It's a botanical. You take it
Okay.
twice a day. Takes a few
Yeah,
months to
yeah.
really start working, but the thing about it is that it is systemic, and if you suspect pregnancy or if you're trying to get pregnant, then you can't be on it.
Yeah, and I know that it's also being used in some of the nutraceuticals for hair loss. So,
Mm,
certainly if you're not pregnant or trying to get pregnant, that could be an option, right?
yeah.
Um, so yeah, the other thing I'll say, like since we're talking about hormones, right, is that studies have shown that people with acne can have low vitamin D levels. And so while
Mm-hmm.
you're seeing
Mm-hmm.
someone like Dr. Gibbs, go ahead and get that vitamin D level checked. Most
Mm-hmm.
people are low, especially if you live in an area where you don't get a lot of sunlight, or if you have darker skin, it's harder to metabolize
Much
vitamin D
harder.
in your skin.
Much harder,
Yep.
yeah.
And then also as we age, even someone like me, you are the two of us, right? Like it'll be harder to metabolize it in the skin. And of course, as a dermatologist, there are much healthier, better ways to get vitamin D than sitting outside getting sunburned. So yeah, get your vitamin D levels checked and
Oh, don't I
supplement.
know
And
it?
a lot of times you need much higher doses than what's just in your multivitamin.
I agree with that 100%. Yeah. I check that on pretty much everybody who comes in my door. And I recommend a blood level for vitamin D somewhere above 65 when you check it on a blood test. And people think, oh, that blood test is super expensive. Well, it's really not. I can order it for a cash pay patient for about $11.
Oh,
So
wow.
it's not expensive. It's not an expensive test.
Yeah, that's great. Yeah, there's such a wide range in the normal range, right? So I think
Mm-hmm.
you're absolutely right to say probably, 50 and higher, 65 and higher, that's really where we want to be. That if you're at the low end of normal, you may still want to supplement.
Oh, absolutely. Yeah, no, 100%. So, so as folks head into menopause, I have this question about something that I heard about, and I was like, that sounds really, really weird. But the question was about a compounded estriol cream for your face to try to keep you from losing collagen and getting this where your face goes from most of the fat up
Yeah.
around your cheekbones to now the fat's around your chin instead. So how do you feel about some sort of hormonal facial cream, and are there any drawbacks that you can think of that could be experienced by somebody using something like that?
Yeah, so I actually love it and am starting to prescribe it to people. It's now available through one of my favorite compounding pharmacies, Skin Medicinals. And yeah, I think we're going to be hearing a lot more about it, right? Like there's this whole movement now to say, wait a minute, hormone replacement therapy is not this horrible thing that we thought it was, that previous studies have now been, retracted and everything.
Debunked,
And
basically.
it,
Right.
exactly, exactly. So I think, my generation of women, I think are going to be now offered hormone replacement therapy or go on it. And so it will be interesting to see how we age compared to my mother's generation, where they were offered nothing. They were told just that's the way it is. Good luck. Right. So
Yeah,
it'll be,
exactly.
it'll be very interesting. And now that we're seeing this sort of push for, letting women have hormone replacement therapy and understanding the important role of estrogen, now we're seeing it in skincare, right? And it makes complete sense. And actually, I was talking with the OBGYN recently, and she was telling me how the topical estrogen that I didn't realize this, like you still need it even if you're on systemic hormone, the patch or oral estrogen, because for whatever reason, the skin down in the vulva area really needs that topical application. And now
Sure.
people are using it on the face or really
What?
you can use it on any skin, right? Like,
Huh.
clean hands, right? Like, let's make sure we're using it
Yeah, of course.
in a clean way. But yeah, so the great thing about it is that it's not systemically absorbed. So if you're worried about systemic absorption, you do not
Mm-hmm.
need to be. And we know that our skin has estrogen receptors, hair, all of this is important. And we know that
Right.
estrogen's important for collagen, because why else would women have this dramatic drop in their collagen up to 30% within 5 years after menopause if estrogen didn't play an important role? And so being able to rub it on areas, now I'm not going to rub it all over my face or my whole body, right? But rub it on
Right.
the areas that you tend to see the collagen loss,
Yeah.
or around the eyes, tops of your hands. You could do it on like your lower face as well. So I think it's really cool. It can be a little sticky. It's not necessarily the most elegant cream ever,
Mm-hmm.
but that in combination with a tretinoin in the evening and sunscreen. I mean, I think these are really powerful ways to maintain your collagen that are really, really safe. And yeah, I think topical estrogen is something we're going to be seeing a lot more of, and I'm a big
Yay.
fan of. Yeah,
Yay. Yeah. So I actually recommend, topical and systemic to almost everybody that I
right.
see, unless they've got a specific contraindication, and those are a lot narrower than what we used to think, because used to be it was like, oh, I have a family history of breast cancer or this or that. And really it is narrowed down quite
Yeah.
significantly. Just the more data we get, the more we're like, oh, well, this is actually good. We should use this. So
Yeah.
it's been great.
Finally we're looking into this and studying it, right?
Right, right. Well, so do you have anything in particular? So I'm going to just describe a patient case to you and
Okay.
and see if you have anything in particular. So this is a early perimenopause menopause woman who does have Hashimoto's disease and is on thyroid medicine, but she recently started having hives. So she just gets these bouts of hives every couple months. She ends up with, 8 or 10 days of just can't stop scratching, just blown up with hives. And everything that she has tried so far has, one, been not adequate to help her recover fast, and two, very, very sedating. So is there anything I'm missing with her? I mean, part of why I think she's got it is because I think she doesn't have her hormones optimized yet. So her T3 level and her T3 reverse T3 ratio, which is something I talk about a lot, are not optimized
Mm-hmm.
yet. But until I get her there, is there anything that I can do for her? Because she is miserable.
Well, and they're true hives, like urticaria. They come
Yeah.
and go in
Now
different
she,
spots. And
yeah, she went to the emergency room. She went to a dermatologist, and it's just like nothing's working. So,
yeah, well, I mean, I'm sure she's tried like antihistamines,
mm-hmm.
but things like Benadryl, diphenhydramine, that can be sedating for sure. A lot of times with you want a non-sedating, try things like Allegra, and sorry, I'm using brand names, right? It's just
That's okay. It's okay.
Allegra and Zyrtec. And sometimes, even though they say take it once a day, I'll tell people to take it morning and evening if it's really
Mm,
bad, and that can be helpful. The other thing I would recommend is topical, like try a strong topical steroid in like an ointment formulation. I find that works better, that she
mm-hmm.
can rub on as soon as she notices that wheal appearing. Other thing I'll recommend, if it's feasible, I know it's hard if you're at work or in public, but ice is great to help break that itch scratch cycle. So throwing on an ice pack to something that's really driving you crazy and itching, because even though the itch feels really good in the moment, it just makes it worse.
Oh,
So
yeah.
sort of tricking your brain to feel the cold sensation, kind of numbing it, and then putting the ice on. But yeah, something strong like clobetasol as a topical steroid, I think could be helpful. You could even, depending on where on the body, like cover it, wrap it so that you got some increased penetration there.
Mm-hmm.
But those are things I would try. Yeah, unfortunately, it can be tricky, and sometimes we don't fully know what causes it. It might be time for a biopsy if it's
Oh,
really
okay.
been long lasting, and might be
Mm-hmm.
time to do some extra blood work, like things with her complement levels, kind of a more thorough workup for urticaria than if it's not improving.
Yeah. And is that something that an allergist would do, or is that something you do?
So, there's probably some overlap that a dermatologist who does general dermatology certainly could do that.
Mm-hmm.
Maybe call to make sure, if you're, I don't think like your cosmetic dermatologist is going to be the best person to do a full
Right,
urticaria
right,
workup,
sure.
but certainly a dermatologist would be able to do the biopsy and would be trained in that.
Mm-hmm.
And an allergist would probably be less familiar with like this. Well, I don't want to say that. An allergist could also, I don't know if they would do the biopsy, but they could also evaluate this as well.
Sure. Okay. All right. So I do have one more question that I really am curious about, and that is these hair, skin, and nails supplements. And I want to know whether you think that they do anything, if they're any good, if they can help people regrow their hair when they start thinning, because many of the conditions that I treat, people come in and their hair has gotten so thin that you can see their scalp through the top of their hair,
Mhm.
and they come in on all these supplements that I'm just like, I don't understand. I don't know the value of them, and I just wondered if you had opinions on those.
Yeah. So I missed this very, very first part. Did you say biotin specifically, or you were just saying hair
Biotin,
supplement?
yeah, a lot of the hair and skin supplements seem to have a lot of
Yeah.
biotin in it, and
Yeah.
so
Well,
yeah, just
Dr. Gibbs, I'm glad you brought this up because this is definitely an issue we see as dermatologists as well. And in the past, in the olden days, biotin used to be hailed as this supplement that can help with hair growth, strengthen your nails. And what we've now discovered is that it really doesn't help with hair growth. It
mm,
may make your hair stronger when you have it, but it really doesn't help with hair regrowth. And the problem is people are getting high doses of biotin, and they're kind of
right.
double dipping. So they might take a hair supplement and it's got 10,000 micro units or micrograms of biotin, and then they're going to take another supplement that also has biotin, and then they may also take a purely biotin supplement, right? And so they're taking these incredibly high levels of biotin, which unless you're truly biotin deficient is unnecessary. But the danger here is that it can actually mess up your blood work, as you know, right? It can mess up your thyroid
Absolutely.
blood work, and it can mess up if you are having a heart attack or you go to the emergency room and they're concerned for that, you're having chest pain. It can mess up your troponin levels when
Oh,
you're there. And
I
so
did
we
not know that. Wow. Okay.
yeah. So you definitely do not. And I've also heard it can mess up pregnancy results too. So really high doses of biotin, not helpful for hair growth and can actually be really harmful for certain blood work. So I do not recommend it. And I would suggest anyone out there who's taking hair supplements to just like flip over and look at the active ingredients and see if biotin is in there. Some of the really popular hair supplements that people use, like Nutrafol, I mean, they have, I think it's like 8,000 units of biotin in there. So, you take that and then you take a biotin supplement, you could have really high levels. So take a look,
Yeah.
see what it is, calculate out what you're taking.
Yeah.
And it probably is unnecessary and it could be harmful. It could cause misreadings of some of your blood work. So there are lots of hair supplements out there and people
Yes.
swear by them. I don't think there's anything wrong per se in taking one. I think we still need more data behind it. For me, like I took Nutrafol for about a month and maybe noticed some improvement, but really a month is not enough to notice it. But
Sure.
it the main fact for me was it's expensive. They're expensive. So
Yeah.
I prefer taking things like minoxidil, which cost
Mm-hmm.
pennies. You can take an incredibly teeny tiny little dose, like half a pill, 1.25
Mm-hmm.
milligrams. And that we know definitively, unequivocally will help regrow hair. So to me, taking a $90, $90 a month supplement that may or may not versus, $11
Generic, but
small
it's a
dose.
prescription.
Yeah,
Yes.
It is a
Yes.
prescription, yes, yeah. So, but you can combine them too. So you could take a prescription thing for your hair and take a nutraceutical, and it's got things like saw palmetto, ashwagandha, some
Hmm.
other ingredients that have some anecdotal or case reports that it could help with hair growth. And in general, it's
Hmm.
not harmful, other than just making sure you're not taking excessive amounts of biotin.
Right. Okay. So I'm a tiny bit confused. So the supplement that you just mentioned with the ashwagandha in it, is that a cream or is that something oral?
No, it's all part of a supplement, like an oral
Oh, okay.
supplement.
Yeah, so yeah, just a little caution about ashwagandha. So I see a lot of people who have cortisol issues. Their stress hormones are just out the sky. And one of the things that ashwagandha is known for is suppressing your adrenal glands that make your cortisol. And the problem
Mm,
with that, the negative aspect of that is that if you suppress your adrenals, you are also suppressing your estradiol, and you are also suppressing your testosterone, and you're suppressing your aldosterone. And when you suppress your stress hormones to a certain degree, then what you get is that your body uses adrenaline to manage stress,
yeah.
because you need something, your body needs something to help you with your stress responses. And if you suppress and block your adrenal glands from making cortisol, then what you're going to get is adrenaline. And it's not a good situation a lot of times. So I pretty strongly do not recommend anything that
Mm.
has ashwagandha in it for most of my patients.
Yeah, well, very interesting. Yeah, I think people hear, oh, it's a supplement, it's
Think it's harmless.
natural,
Yeah, it's
it,
natural.
it's harmless. Yeah, and really, right, like everything has there's pros to things and there are cons to things. You have to
Hmm.
balance them out. But yeah, I just think you do have to be a little careful with some of these hair supplements. They're expensive and the data is variable. And to your point, it may have things that actually could actually be harmful for you instead of helping.
Yeah, I agree 100%. All right. You mentioned to me before we got on that you have a new skincare guide. And so I want you to tell us just a little bit about that.
Yeah, well, so I find that a lot of the information I see online is about what products to use this or that, and I really think that's sort of like the icing on the cake, the last step, right? Like our skin health really has to go from the inside out. But that being said, I've walked through the skincare aisle at the drugstore, and it's overwhelming even for a dermatologist. So a
Mm-hmm.
lot of people are like, just give me some and like just give me some products to look for or what to get, what I need. And certainly my list is by no means exhaustive, but I did try to compile together some affordable and safe and effective skincare products that people can use for their very simplified minimalistic skincare routine. And so I did put that together as a guide for the listeners. So if they want to go to theskinreal.com/guide, they can pick up that PDF that gives them some products to kind of be on the lookout for, and it can try that these are things that I've used or I currently use or I recommend to my patients.
Excellent. So that I'm going to go get your guide right now. Actually, that's going to be good. So you're also on Instagram at Dr. Mina Skin, and at theskinreal.com is your website. So this has been super informative, super fun. Thank you very much for coming on. And
Oh, yes.
do you have any last minute overarching what you tell everybody kind of advice that you could give to the
Yeah.
listeners?
So I would say to all my fellow midlife ladies out there listening is to not get discouraged, to find a routine that works for you, be consistent with it. Ignore all the noise out there, people telling you do this, do that, do, all these expensive things you got to try and devices and at home stuff. And if it sounds too good to be true, it probably is. And really get your information from someone who is not necessarily trying to sell you something. They're just really trying to give you good, solid information. And of course, like a dermatologist, that's going to be, your best bet for healthy skin and kind of save you a lot of trial and error out there. So, stay consistent, get advice from a trusted resource, someone with the training to back it, and really just say no to these trends and all the noise coming in. Just try to filter it out, because believe me, if there was some like magic pill for X, Y, or Z, like I'd be doing it and I'd be telling everyone about it.
Right.
And I'd be promoting it. Right. And a lot of times the sensible stuff, the taking care of your body, like that's not sexy. That doesn't sell a product. Right. But that's really how you get beautiful skin, because as we talked before when you were on my podcast, right, like the skin is a reflection of your inner health. And if your inner health is not, is out of whack and your hormones are all out of balance, and you're not taking care of your body as a whole, no matter what cream or procedure or device you get, you're not gonna reap the benefits like you should. So really focusing health, skincare from the inside out is really optimal.
That is awesome. All right. Thank you very much for coming on. It's been so much fun. And I am going to be really excited to listen to our episode as it comes out.
Yes.
All right.
Thank you so much, Dr. Gibbs. It was a lot of fun.
Take care. Thank you for listening to this episode of Beyond the Thyroid. If you found this information valuable, it would mean so much to me if you'll take a few seconds and give the podcast a 5-star review. It helps other people who need this information find the show, and it's really easy. Just search and click on the name of the show, Beyond the Thyroid, and scroll to the bottom to ratings and reviews. I truly do read and appreciate every one. Remember, when it comes to hormones, there will always be more to discover. So follow the show so you get the next episode as soon as it's released. And if you or someone you care about needs a caring doctor to help figure out how to heal hormone problems that other doctors have dismissed, check out my website at www.danagibbsmd.com. And if you're not a physician, please keep in mind, while I'm a doctor, I'm not your doctor. The content of this podcast is my opinion, and it's for educational and entertainment purposes only. This is not meant to be individual medical advice, and you should consult your own physician for any medical issues or diagnoses that you may have. I look forward to continuing this journey with you beyond the thyroid.